difficult airway cart.
Mm-hmm.
Okay, you can take a shot of that if you want to. Some of our patients, as you go along, they're actually on respirators, and we have to put a breathing tube which goes down into their lungs. And sometimes you need to do that urgently. And some patients can be very, very difficult to try to get that tube in. So we try to keep everything available on that cart for the physician and the nurse and the respiratory therapist. And everything's really pretty much labeled so you know where to grab things. So guide wires,
Mm-hmm.
and what do we have here? You know, LMAs, those are different kind of tubes that you actually use.
That's something that's been sterilized and clean
Yep.
and everything?
Yep.
Okay.
Now, this is disposable, so this
Okay.
came from the company.
Oh,
before,
okay.
But that is sterilized. Yeah.
All right.
Just more tubes,
I'm recording video.
more things than you ever thought you would ever see, I suppose,
Wow, yeah.
coming up here today. So that's just one of our carts.
Mm-hmm.
And then let's go in here.
Okay.
So here's another room. Let me just show you what we do here. These patients who are on the outside have definitely a much better view. So the nurse can take this thing over here. This is what I wanted you guys to see. So let's pretend there's actually like a patient in the bed.
Mm-hmm.
Okay? So go ahead, you pull up your laptop. You're looking online at the medications that you're actually going to give your patient. This is our narcotic drawer. So inside here, if there was actually a patient in here, not narcotic, just medications.
Yeah.
Mm-hmm.
Your medications are going to be in here. So the nurse goes ahead and opens that up. She can look at the computer screen, double check the med to the actual screen, and then turn around and check the patient's ID bracelet to make sure that we are giving the right med, the right dose,
Okay.
giving it the right route to the correct patient.
Oh, that's
So
good.
you start here and then you go there. and
Right.
then-
All right.
And now this is the cart in the room that I was telling you guys about. So again, it's just a matter of convenience. Most of the stuff in here is, a lot of it's sterile, but some of the stuff isn't. So your top drawer is pretty much like your IV supplies. You've seen patients who have a catheter in their arms. We're grabbing from up here. This is like your dressing supply. So if somebody's had surgery and they have a dressing over the wound, you grab this stuff. And then lastly, it's like your personal care stuff.
Okay.
All right, and let's just, I don't know, have you guys ever seen patients in an ICU environment? Because I certainly don't want to scare you.
Oh.
But we'll just
Oh, I
walk
would
by and I can-
probably handle it.
Okay.
So.
So just come on over here for a second. So the nurses can monitor patients from this station here. So this is what we call a central station, a central monitor of the patients that we have in the ICU right now. So they can watch what the heart rate is, if alarms have been set, so they can keep a pretty close watch on the patient.
Okay.
And then, let me just sit in
Do any of the carts come with printers on them?
No, none of the cartridges, so we'd have to come on over here to get
Okay.
the paper form.
Okay.
But let me just show you. You can just look from here, from the corner. See the monitor in the distance?
Oh, yeah.
So that's what is hooked up to the patient. So the 70 on the top is telling you what the patient's heart rate is. I can see 125 over about 66 is actually the patient's blood pressure. And then some of those other waveforms are telling us different things as well. But that's what the nurses are watching
Okay.
most of the shift. Okay?
Okay.
I'm gonna ask Patty.
And then around here, this is the last thing I'll show you guys. This is the Pyxis med station.
Oh, yeah.
So your narcotics are in here. So you can see the nurse has to come up, they identify themselves. You can either do your finger, identifies your fingerprint,
Okay.
or else you go in there and give it your name and your password and it will recognize who the nurse is. Sure. And then you just tell it the medication that you want, and then one of these doors will then pop open and you can take out morphine or whatever the medication might be.
It's pretty cool. Like,
Or like some type of protective lock or code on pretty much anything.
Any medication has to be locked.
Okay.
Right.
Okay. The computers you said that are outside of each room, like
Yeah,
is
right
that
here, these workstations.
okay?
So they're all laptops. And then the nice thing with the way that the room, the ICU has been built, one good thing is that sitting here, you can look at your computer and you still have good visibility of your patient because
Oh,
there's
yeah.
windows there. Okay.
That's good.
It's well designed.
It is.
Yeah.
Okay.
All right.